from bed to wheelchair, then balik na yun wheelchair to bed. Now, for these procedures, this is one of the common procedures, especially if you will be working in the hospital or naagin mo sa elderly homes. Okay? Naagin siya per me almost, almost every day, every 4 hours, 8 hours, magsigig yung mag-perform niya. Especially transferring patient from the room, going to the hallway, going to the activity room or dining area or asa mo na si patient ka naman to. Gets in yun? Okay? Now, for the materials that we will be using for transferring the patient from bed to wheelchair is we have the gate belt, gamit ang gate belt. If in case wala gate belt, later on we will show you how to manually transfer the patient. And we also have the helmet, wheelchairs in your patient. Okay? So let's start with the procedure. For the procedure, naragyan dito sa notes, ako gisaid, nara sa pinaka-ubos mo siguro. Excuse, okay? So first is knock on the door. Okay? Enter the room, then approach to your patient and introduce yourself. Okay? Hi sir, may hapon, ako ni si Prince, yung caregiver ka ron. Kamusta mo ka? Sure ka, okay na ta? Kulak na, or ikaw may kulak na. Ako mo yun yun na. Okay? So, naari ko karon sir because I understand that you want to transfer sa wheelchair and ugawas ka. So, okay na ba i-assist ka? Okay. So, after introducing yourself, explain the procedures, why you are here, and then panangin the patient if it's okay na mo assist ka nila. Gets inyo? Okay? Then, after that one, provide privacy. Okay? For providing privacy, most of the time is wala mo dyan kayo tao nino, but if in case na visitors, much better gawa sila. But if na ganing mga, like for example, kanang mama, papa, anak, na ganahan mo assist the patient, much better. Okay? Kung ganahan mo assist, patabang po. Yan sinyo, ayaw pag inarte na gawas na po kagapil ma'am, ayaw. Okay, let them also witness or let them assist para makabawon sila kay, let's just say na ma-discharge niyo pasyente sa hospital, so sila ni mo liyong dito. Yan sinyo. Okay, now after providing privacy, do hand washing. After doing hand washing, then you have to prepare the bed. Okay, for the bed, it should be at least level sa hips yun ni patient. Okay, then all side rails should be locked and all wheels sa bed should be locked. Kasi naka-lock kinatanan ang wheels. Gets in you? So again, the level of the bed should at least at your hip level for good body mechanics na siya. Okay? Sir, what if kanang ang bed ni patient is ordinary bed, dili hospital bed? Ubus bed na, di ba? So all you have to do is ikaw mismo mo just either mo bed yung ka, ana yung ka mag-assist ni patient, okay? Or mo request you can, if it's okay, dapat mo purchase dito ka ng hospital beds gitu. Para comfortable si patient and comfortable sa as a caregiver. If private homes ni siya, okay? Usually if you will be working as a kwan na most of the patient is mo palit sila ko galing hospital beds gitu. Okay? Para comfortable na po na tigasi sa nila. Okay? Next one is we have to position the patient in a sitting position. So how do we do that? Okay? So first is ask your patient na, sir, okay na ba ito tanang mo ng habol? Okay, kay palipuro na tika. So next is make sure that the patient should at least be at the edge of the bed. Nana siya sa kilid sa bed. If ever the bed is dako jud kayo, so assist your patient in moving sa bed. So for example, dito, let's just say dako kayo bed ni patient, okay? Okay. So if the patient is layo ra kay siya sa side sa bed, then ask your patient to move on the side. So utang lang mo kamot diri sir, and diri mo ang straight line mo do ka tin sir. Straight line. No. Okay. Then assist your patient, okay? So how do we move that one? So gunit ka diri sa opposite side, the shoulder, and gunit ka diri, then hinahina na move si patient. Now if you cannot carry your patient, you really need
Step by step.
Dili gid pwede na makuha, okay? Or kung dili mo da, insert tawag ka ng slide sheets. Later on, we'll be discussing about slide sheets. Naran yung mga lalang technique on how to move the patient. Gets inyo? Yan ang nakin para mag-concentrate on how to transfer the patient sa wheelchair, okay? So once the patient is on the side, tas yan. Okay. So So once the patient is on the side na siya, ato nang i-prepare si patient. Okay? So first is, let's put the patient on the sideline position. With the kilid na siya, kilid na siya. Okay? Sapa niyo kung sakitin. Count of 3, sir. Takilid na. 1, 2, 3. Takilid. Okay. So once na katakilid na si patient, ang duha niya katingin is straight line mo daw katingin, sir. Okay? Then ato nang idaw.
Sir, action sa kabalata, sir.
Idaw niya mo daw katingin, sir. Uy! Kagaya ba niyo katingin? Ano mo ka? Oh, kana. Great. Now, there's a reason why ganun i-drop na to ang duha ka tiil ni patient. Okay? Para palingkod na to niya, naka-drop na daan na iyang tiil. If ever magud ang tiil ni patient is naa dire, straight mo tiil, win. If ever na siya dire, maglisod mong palingkod na niya. Okay? So let's start first with what if nakabintay siya. Okay? So sir, palingkod ka sir ha? Sir, at the count of 3, palingkurong tika ha? Okay. 1, 2, 3. So kung nakadrop ang tiil daan ni patient, okay ra kayo. Now, kita balik. If ever wala siya nakadrop, okay, maglisod mo palingkod ni patient. But if ever gani, ingunan na lang yung position, so all you have to do is gulit ka diri sa iyang shoulder and gulit ka diri sa iyang tail. Sir, at the count of 3, palingkurong tika. 1, 2, 3, likod. Gets inyo? Okay? So that's how you do sitting position. Much better na inyong i-drop ang tail ni patient daan. Okay? Para dali na kayo siya makalingkod. Once the patient is in a sitting position, ask your patient, sir, nalipong ba ka or wala? Okay? Now, why do you need to ask if nalipong mo siya or wala? So if ever the patient is nalipong na siya, there's a possibility yung blood pressure is naubos po na siya. So let the patient rest. Okay? If the patient still feels dizzy after pila ka seconds or minutes while the patient is at rest, then check the BP. If the BP is too high or too low, then put the patient in a resting position. Bigdaan na lang siya, balik ay papawaya. And monitor the vital signs. Gets ninyo? Okay? But if the patient doesn't complain about dizzy, then continue with the procedures. Gets? Alright. Next one is sapatos ni patient. So kita niyo mong taon sa sapatos ni patient.
Yay!
Sana all.
Ayaw mo kagol when it comes to the shoes sa mga clients who are using wheelchairs. Most of their shoes are they're using kana mga slip-ons lang or kanang Crocs pareha na yung gisuot. Okay? Nihit na kayo mo makita o kanang mga clients or mga patients na mugamit o kanang mga shoes with shoelace. Kasagaran na nila mga easy to wear na gina mga shoes na ginang suot. Okay? Sir? Tulong na sila.
Sana all.
Cinderella!
Isuot na na sa doon! Kung kayo tail! Klaro ni mo sila. Mayroon tas kig-medyas na niya. Ano ko medyas eh? Ano ko medyas mo? Mau gini mo medyas?
Gikan siguro sa uyab.
Ha?
Gikan sa uyab. Mo dai ring asawa.
Okay. Alright, next one is naka-sitting position na si patient. Then next is the wheelchair. Prepare na to si wheelchair. Now, for the wheelchair should be at the side of the unaffected area ni patient. Okay? Or kung asa man gani ang good side ni patient. So you as a caregiver, you have to identify kung asa iyang good side ug asa iyang bad side. Gets ninyo? So try to ask your patient, sir, asa yung mga good side? Left side, sir. Left side, okay. So the wheelchair should be at the left side of your patient, sir. Okay. Then dapat naka 45 degrees na siya angle sa bed. Ano? So that it will be closer for the patient to sit down sa wheelchair. Gets ninyo? Kung nakaingunan ni maguni siya, okay, tako pa siya glapon. Okay? If nakaingunana na siya, mutuyok pa si patient. But if naka 45 degrees na siya, okay, mas closer ni patient. Gets ninyo? Okay, masayon pa na siya. Okay? So once the wheelchair is in a position, then lock both wheels. Okay. Then footrest should be at the side. Kato footrest same sa kato kanana quad wheelchair. Then prepare your patient na yun. Okay. Now for the patient, you should be using gait belt para dali na nimo siya pa para good. Sir, gamit ang gait belt. Sir,
Excited.
alright, so how many fingers gani?
3.
Sir.
2 to 3? Okay. 3 to 4 will do for the gait belt. 2 to 3 is anches. Sumba? Hindi ka rin. Siguro ko sa ikingon niya? Kung babae ko na, usan ko rin siya sumba. Alright. Okay. Next is pabarugo na to si patient. Now, our role is to make sure na makabarog si patient stand straight kina siya using the gait belt. Okay? So how do we do that? There are different types of position. It could be in between sa iyang legs na ato ko sa kaleg. And the other leg is nasa luyo for base of support para dili matumba si patient o si caregiver. The other position is pwede mo mag knee to knee. Ana, knee to knee and toe to toes para ligbaro ka na niya straight dita. Now, if you are a new caregiver or bago pa rin si patient sa inyo I would highly recommend na in between sa iyang legs. Kaya nga naman, wa pa makakibawon sa weight ani niya. Okay? Naiuban patient na gamay pero ining ansa ni mo, uy, bukat man ni gini siya. Bukat kay sala ning tuman sa siya. Okay? So, okay? Alright, so si patient is gunit na diri sa inyong shoulders. Ayaw sa inyo ha, liog. Kaya nga naman, kung ari diri sa inyong liog, basin mabalik. Ang inyong neck will never know. Okay? Mangusog yan na si patient yung baro. Ari na siya, then gait belt. Then sir, at the count of 3, barog ka. 1, 2, 3, barog kayo. Okay? Then, the patient will walk. Okay? The patient will walk using siyang good foot. Okay? That's the reason why nanong mo na siya closer sa wheelchair because ang iyang good foot, mo'y muda sa iyang body. Gets ninyo? Kaya kung ang bad foot ni siya, mo na na'y magdadan sa iyang body, masakitan ninyo mga si patient.
What
Gets?
if puro bad foot?
Okay, if ever puro gani bad foot, you really have to identify kung asa dyan at least man lang mas kaya pa giniya. Okay? But if the patient cannot stand up straight because of both kana legs are injured, then mo gamit atong hoist. Do you know what hoist is? Kanang murag alsahon, murag siya
Machine,
crane,
sir.
machine.
Okay.
Alsahon ninyo si
Alsahon
patient.
mo si patient.
Kaya ibalik na siya. I'll send you a video kung sa itsura ng hoist and how does it work.
Yeah.
Shoot,
Kabalo na ko ano siya. Ako pasyente mo na
Muna na
siya.
ilang gamiton, okay?
Live shoot, sir. Pareho sa alsa.
Na. Then hato din si patient sa wheelchair, okay? Likod. Okay? Then remove the gait belt. Okay? Sir, wala na kabalik pong sir? Wala na. Okay, good. Then footrest, down din ang duha ka footrest. Okay? Then once you are ready to move, then unlock na yun ang duha ka set. Okay? Then deliver, ihatod din yung patient kung asa siya. Then on. Gets ninyo?
Yes.
Okay? So once nakabalik na mo sa room, by the way, going outside sa door, okay? Pagawas mo sa puntahan. Ilahaw sa stairs. Kung pagawas, kinsay una.
Ikaw.
Okay, dapat si caregiver ang una mo gawas. Why?
Para makakuan ka for safety kay basin na
very good.
mo.
For safety. Ibasin niya kung siya una mo gawas niya, na mo sugat dito sa gawas. Di ba kita?
Disgrasya,
Okay,
sir.
so, injury na the patient. So how do we do that? So, tuyo pa
Turn the
siya.
paan.
Okay, then hinahinga dito. Kung si siya, uy, yawa na ko eh. Ikinig ko na. Mike Wazowski, then gawas tayo kaya, then that's the time, dagan na tayo mo. Okay? When you go inside sa room, kisay una. Ha?
Ang patient na.
Ha?
Ang patient.
Pwede si patient,
Pwede
pwede
sa
si
caregiver.
caregiver. For safety purposes, much better si caregiver ang mo
Una.
Kaya naman,
Same
we had
organ.
incident before naghatod yung patient going to their room, pag suot na mo sa room, wa may kibaw na na-day bisita, na-surprise ba? Okay? So when we enter the room, nisugat po ng bata. So nabangga silang duha. Okay? So for safety purposes na lang, much better muuna lang yan si caregiver. Okay? But most of the time, muuna yun si patient yun, pasulod na sa room.
Okay, sa room.
Okay? Iyan naman ang room, mingaw naman ang. Kibaw lang ta na, one tao diya most of the time. Okay? But for safety lang, much better ikaw po muna. Okay? Now, pabalik na ta. Ganiya, ang wheelchair na dire. Okay? Karon is naroon po siya dire sa pikas na side. Okay, 45 degrees. Nga naman. Okay. So that ang good foot doon na po sa bed. Kaniya ang good foot doon sa wheelchair. Karon si good foot doon na sa bed. Kaya mo naman sa nimuda. Okay? So lat. Mo na yung good foot. Ang bot mo. Sabi mo lang kuwan, di ba?
Mauna siya ang good foot ah.
Walang good foot.
Di, mo na yung good foot ganiya. Mo na yung bad foot. Ha? Ang bot ni mo siya. Murag ka na. Sayop ka. Sa side ka siguro ay nakoy hatod. Okay. Next one is tawag dito sa Sige. Then, saka din na do ka footrest. Then, in between it's a tail patient. Bulit the reserve. Alright? Then, bulit sa gate belt.
I love you.
One, two, sakto kasi ito. So, while nakalikod si patient, ipalayo lang ang wheelchair niya, ha? Okay, ha? Then, remove the footwear of the patient.
Pagi mo na dyan ang carrier, sir.
Okay? Then, pag-down na rin siya. Okay? Sir, pag-down na ka. At the count of 3, ganun ang count, sir. Okay? At the count of 3, pag-down ka. 1, 2, 3, higa. Okay? Straight na tail, sir. Then, that's it. Wala na kabalik po, sir. Hindi po, sir. Okay, now, what if walay gate belt? How do we handle the patient na walay gate belt? No, wala
Dili.
bitay ng mga materials ba?
Hawak, sir.
Ihag. Murag ihag siya.
Okay. Alright, so pwede na sa hawak, ana. The problem with hawak is that slide ka. Gate belt then dire na sa
shoulder, sir.
The count of 3, 1, 2, 3, baro. Dito na ba dito? Dire na ba dito? Unya na. Okay, again. Okay, kanina lagi para seryoso kayo.
Gamay man na siya, sir. Ang dakdak ko.
So, in between sa legs ni patient, ana. Okay? Then gunit there is a shoulder. Then gunit ramo there is a armpit going to the shoulder ni patient. Then the count of 3, 1, 2, 3. Baro gayon. Ana ra na siya, simple. Okay? Hawak mo ko sir, maglisod mo kunin sa hawak, especially dako kayo si patient. Okay, basta niya maglisod mo dahil tendency is
Sir, hindi na sa gamit.
sakto lang mo